Hi, and welcome back to the Dr. Ramsey Show. Today we get to highlight one of our revolutionary machines. We've never had a machine like this in our office, but it's a fantastic machine. We're getting excellent results. The name of the machine is called Evolve. It's a body contouring system. And we have someone here today who's running the machine. I want to introduce Angela Kleitz to you. She's been running the machine for us. She's a personal trainer, so she knows a lot about the physical body, how to get the results you want with your body composition. And so since she's been here, we've been getting amazing results. Prior to that, we were kind of piecemealing it, but with you here, I mean, it's a game changer. I really appreciate you being here, Angela, and helping us out with the Evolve.
I appreciate you for trusting me, as you would tell me.
Oh, I do very much, implicitly. Even like we were supposed to have a guest on today. His mom was sick, so he couldn't be here. But let's just talk about Mark, for example, because he wanted to share his results, and I know his clothes are fitting him completely differently. And he really just started. So do you mind sharing a little bit about Mark and his outcome?
Yeah, so he's only halfway through his treatment, but he's very adamant of what he does for working out. He does whatever you tell him regarding health. So always on supportive supplements, amino acids, electrolytes. We're moving towards that direction, but he's got a personal trainer in 2 different states. He's always doing something, but he listens, and he doesn't just take it with a grain of salt. He really wants results, and he has used cryotherapy in the past, which didn't work for him. So,
and cryotherapy is cold sculpting or something, isn't it?
Yeah, it's using cold, where we're using heat.
Right.
So,
and I've learned that with the cold, there's some risks and things with the way it looks. I don't really know much about it. With ours, we don't have any risks. There's no downtime. What our machine does specifically is it trims fat, it tightens loose skin, and it tones muscle wherever we want to. And specifically with Mark, because he was supposed to be here, he's doing his belly?
His belly and his chest.
Okay.
Yeah.
And so his pants aren't fitting him properly anymore, or
his
they're fitting looser on him. And I know we've had some really good results with females, myself included. We'll show you some before and afters at some point. But I've had some great results myself. So talk a little bit about how the machine works.
Okay. So as you said earlier, there's 3 treatments: trim, tighten, tone. Right. Trim is essentially what it sounds like, to trim an area, especially cellulite. We have a lot of women in here that's, cellulite is a big thing, including me.
Right.
Tight, you said loose skin. That one uses radio frequency, and then tone is no radio frequency. Tone is just muscle contraction, as if you would do it at a gym.
Right. And we were trained that when you do the abdomen with tone, it's like doing 70,000 sit-ups.
Yes. Yes.
And it feels that way to some people.
Yes. Some will feel discomfort as if they went to the gym. Some don't. It just depends on how much the muscles are contracting, how active they are, how inactive they are.
Right, right. And I know that one of our patients, we can't really say the names, she lost a lot of inches, because we do pounds and we do inches. It's not a weight loss machine. It's a body contouring machine. And she found that, I think it was like 14 inches, or I don't remember the amount of inches, but she's on maintenance now.
Yes.
And other body parts. So we could do the belly, we could get rid of the fat, tighten the skin and tone the muscles. The glutes is what I'm doing, and I think it's working amazingly. We can do the arms, for women that get the looser arms underneath. When you say chest for Mark, I haven't heard that yet. So what is
the pec muscles?
Right.
So a lot of men, they're gym rats, and they're always focused as upper body.
Yes.
So they want these to be like defined. Not every man, but I've seen a lot of people, men specifically, that are very focused with up here.
Oh, that's so interesting.
Yeah.
Right. And I've seen too, the ladies with like the crepey skin, they've done tightening for the skin, and that's all they have to do.
Right.
They don't really need tone or getting rid of fat. You don't need that on your legs, but it's really beautiful to see the outcomes. And the reason I enjoy this so much is, like, for 25 years, we've had the privilege of helping people feel really good on the inside. That now we have a very safe and very effective, non-invasive procedure that we can complement the way we feel inside. I know myself, and I'm going to be candid, in my 40s, we had somebody here who did Botox, and he kept saying, "You want some Botox?" I'm like, "No, I don't want Botox." But then I saw a picture of myself, and I looked like my son's grandmother. I mean, honestly, and so I started doing Botox. I'm like, okay, I can't feel so good on the inside and look like 100 years old on the outside, especially being a sun worshiper like my whole life. So I'm also vain. Some of our patients aren't vain, that those are vain, take advantage of it. So are there any risks involved with the machine?
The only, I mean, we have a standard procedure that we go through before we even get somebody on the machine. Pacemakers are a big thing. Anything that's like inside the body.
Yeah.
If you've had history of melanoma, that's not a thing.
Meaning, if it's a melanoma, you can't do it? Okay.
Yeah, any type of skin, any lesions, anything like that. Keloid, so keloid scars.
Yeah.
Anybody that suffers with that, it's just your skin is really sensitive. So, but other than that, we make sure to go step by step, ask these questions, make sure that everything checks out, and then we move forward with the procedure.
And how frequently are people coming in for the treatment?
So what we're doing right now is twice a week for 12 weeks.
Right. And I like that a lot because in the beginning we were doing it once a week, and I think the results are much better doing it twice a week.
Yes, I agree.
Yeah. So who's not a candidate for this machine?
Somebody, like you said earlier, it's in a weight loss device. Right. It's a body contouring device.
Yes.
You really have to get that into the patient's head because when you're doing hormones and you're on supportive supplements, you do feel good on the inside. But as you age, there's, some things that we may not like about our bodies.
Right.
And we need to make sure that they know we got to exercise. We got to do our supportive supplements, aminos, all of the stuff. You just can't put it to the side. It's a supplemental type of work.
Right. That's the way to look at it.
Like go to the gym. You're going to make your body good. You're going to keep going, but you got to have maintenance.
I've gotten as far as I want. Now I've got some spot areas, belly from babies, whatever it might be genetically. Right.
Yep.
Right.
That's
so
right.
No risks. You'll tell them if they're not a good candidate. You'll help them get the best results by giving them a good lifestyle program.
Yep.
And then also you offer personal training for those who want it.
Yes.
Because I know I do training with you and I love it.
Yeah.
So anybody can do personal training with you that would like to. And I hope our patients take advantage of that.
Yeah. No, I take a lot of the principles that you've taught me and you've taught many of your patients. And then people that are brand new to it, I like to educate them and then refer out to you.
Yeah.
So that's like the hormones are like what run the show. So
I know. Without the hormones, I don't think the machine would be that successful.
I agree. I totally agree with that.
Yeah, statement. Because testosterone makes our muscles really tone, burns our belly fat, burns all fat. Even estradiol burns belly fat. So yeah, the hormones are the messengers of our cell turnover. So yes. I'm grateful because you appreciate that. About health and fitness. You're perfect running the machine.
Thank you. I appreciate it.
Thank you for being with us,
Yeah,
Angela.
thank you.
And thank you for listening to the Dr. Ramsey Show. I hope that got you inspired. I love it myself. And now we're coming upon the holiday season. And for the next 2 weeks for Christmas and New Year's, we're going to take a break from the Dr. Ramsey Show. Have a beautiful holiday season with your family. And we'll be back the second week of January. Bye-bye. Have a great day.